Prostate cancer is the second leading cause of death for African American men, and Saturday, the 5th annual Prostate Health Educational Symposium will take place at the St. Paul AME Church in Cambridge. The free event's a partnership between Reverend Alice Washington and a national education and advocacy group, the Prostate Health Education Network. To tell us about the symposium is our guest from the network, the founder and president, Thomas Farrington. Thank you very much for being in with
Chris,
us again.
thank you again for having me.
Tom, I want to start with the beginning of this because along with founding this organization, you are also a prostate cancer survivor.
I am a 17-year prostate cancer survivor. And I've really been blessed over these years to have a good quality of life as I face prostate cancer. And Chris, one of the important things for me has been education, and not just early detection screening, but education about the different treatment options, also education about how do you live successfully as a survivor. And you know, those things don't just come automatically. And what we try to do with our symposium is to provide men and their partners with this level of education.
I guess for all men, maybe, there's a lot of apprehension about addressing health problems. If we don't think about them, they won't bother us.
That's right, if you don't feel them.
Not good advice. But what about prostate cancer? Is this worse, you think, maybe?
Well, actually, in many ways, it is. Because, you know, we kind of joke about if you don't feel it, you know, you don't have a problem. But with prostate cancer, that is kind of the drill. Prostate cancer really doesn't cause any symptoms many times or pain until it's an advanced stage. And this is a wrong time to know about your prostate cancer. So getting men to be knowledgeable and kind of staying up to date through early detection screening about the prostate health is a real challenge, because men would simply say, I'm feeling good. You know, I can go out and at 40, 50, I still play golf, play a little basketball, and everything's well. I can't be sick, but that may not be the case with prostate cancer.
What about the screening? Is this something that for most people is very complicated or uncomfortable? What's it like?
Well, actually, screening for the most part is a blood test. So it's a very simple test. There's been a lot of controversy around prostate cancer screening because I would say from the mid-90s up until 2012, there was a lot of screening promotion. But then in 2012, the U.S. Preventive Services Task Force came out and said, hey, maybe the tests, some of these clinical trial tests, they don't show that there's a great benefit for screening. And all of the prostate cancer doctors, along with survivor groups, said, hey, you know, we think screening is important. Early detection is important, because with prostate cancer, if you advance at a later stage, you can't cure it, but you do have a chance to cure it at an early stage. So screening is typically a blood test, and then if the blood test seems to be abnormal, you can have a digital rectal exam. And that's changed somewhat, Chris, as well, because it used to be that the guidelines call for a physical exam along with a blood test. But now many of the guideline setting organizations are saying, let's begin with a blood test. And if the blood test is elevated, let's look at a digital rectal exam.
This is BNN News. We're talking with Thomas Farrington from the Prostate Health Education Network. Thomas, the other thing that's been going on with these symposia is that they usually happen at churches, and this is not just about convenience. There's a reason for this.
Absolutely. Number one, it's two reasons. We're very anxious to reach out to the community. We want to reach men, and we want to reach women, because women will, they have a lot of force and a lot of influence on making men do what they should do. If you reach men only, men will hear, but still many times not do the right thing. So we try to reach the whole family. We can do that at the church. The other thing is that faith plays an important role in facing and managing prostate cancer. When I was diagnosed with prostate cancer, I think I told my church family first, and I got a lot of support there. And that's important. It's very important. We have two programs where we focus on church support. One is the symposiums that we're holding in 25 cities this year, and the other is the Father's Day Rally, which is more of an awareness campaign, which happens on Father's Day service. And we will have hundreds of churches all throughout the country who participate on the Father's Day Rally on this Sunday.
So talk about the importance of connecting with a network, because even if it's not necessarily all that spiritual, just being able to talk to somebody about a problem.
Right. And one of the things that, there's a whole culture of silence around prostate cancer. And what we found, for instance, with our Father's Day Rally, because the rally really happens within individual churches, and we ask the churches to invite survivors, family members, and those who've lost loved ones to the disease to the altar for special prayer. And we provide materials that they hand out to the congregation. And what a lot of men found was that there were people in that church that were dealing with prostate cancer, and neither of them have spoken to each other about it. So it brings them together. And we also, some churches are putting together networks where they come together around our programming, monthly programming. So they can view that together, our webcast, and interact, and then create a supportive group right there within those churches.
We should give a little more details about the time and place for the symposium and the rally.
Well, the Prostate Health Education Symposium will be held Saturday from 10 a.m. Until 2 p.m. at St. Paul AME Church in Cambridge, Massachusetts, which is located on Bishop Richard Allen Drive. And
you've got a rally, of course.
And then on Sunday, we're having the Father's Day rally within the churches, and one will be held to St. Paul and other churches around the city and around the country.
Thank you very much.
Chris, thank you so much. It's good to be with you again.
Thomas Farrington from the Prostate Health Education Network.